Sorry. All right, hold on. Hi guys, give us 1 second to finish getting everything set up. I wonder if I'm too loud. So we learned a couple of things from our last live. One being that we sounded a little echoey, so we have this cute little microphone now. So hopefully that'll keep the echoes from going or from happening. Okay, perfect. I think we're good to go. Also, we're going to try this time. I'm trying not to use my hands too much and watch my facial expressions while I'm really thinking. All right, so we have a special guest. Dr. Franklin is jumping in on this session with us. We originally just had Dr. Schwertz, but they both do a lot of dry eye treatment, so we thought it would be great for both of them to be here to talk about the experiences they have with both patients and success rates that they've had with the treatments here, because they can both offer up totally two different ideas. So I'm already doing it with my hands. So the last live that we were on, we addressed, how we evaluate dry eye, what is dry eye. And, we talked about the fact that there is no cure, no permanent fix to dry eye. So to follow that, we're going to discuss, to start off with, since there's no permanent fix, no permanent cure, why would somebody come in to treat dry eye if it's not going to permanently fix it for them? Why would they waste their time doing any treatments for no permanent cure?
Well, first off, like we said last time, dry eye disease is a chronic progressive condition. So if you don't intercept that at a point where you can do something about it, things are inevitably going to get worse. And I think the one thing that we stressed at the last Q&A is that the biggest thing that can be affected is your quality of life, particularly your vision. And that is the biggest thing that we are dealing with our severe dry eye patients on a day-to-day basis, is how much their quality of life is affected, how much their vision is affected, and if you don't intercept this at a point where it's treatable to a level where you can improve it, then your vision's gonna be affected severely. So,
yeah, I agree with that. I mean, you have to get into the treatments to kind of minimize the symptoms and to allow quality of life to kind of join to be there, because as you go and as dry eye keeps progressing, quality of life keeps kind of going down. You can have several stages of dry eye, from the mild of just just kind of starting to feel things to the super severe, where some of our patients aren't driving and they're not working or doing the things that they love to do. And so these treatments that we have really try to help to get patients back to doing all the things that they want to do.
Right. And I feel like in our everyday life, with our cars, our health, all kinds of different things that we do in our everyday lives, we take medications for allergies, for diabetes, all kinds of different things, that those medications aren't fixing the problem permanently, but we take those to help our bodies maintain a certain level of healthiness, right? Mm-hmm. And if we didn't take them, we would be all out of whack. So I mean, it's kind of the same thing, right? We take these medications not to permanently fix it, but because we want to feel good and we want to have that relief, knowing that we have to get up and take it again in the morning. So right. I think that's kind of the same concept. You're coming in and you're doing these treatments to keep your eyes and your glands healthy. Even though it's not a permanent fix, there's always going to be maintenance to it. But I think that goes for just about anything in life. There's not really a permanent fix to a lot of things, but we take things, measures to help keep us comfortable so that we're not in a lot of pain or suffering, right?
Yeah, completely agree.
Yeah. So we also had talked about follow-up treatments, maintaining the glands. How frequently do you normally follow up for evals after we've done treatments?
Yeah, so I mean that can vary depending on the particular treatment that's right for our individual patients. If we're doing treatments that are more on the moderate to severe side and we're using our intense pulse light machine or our radio frequency machine, we're going to do a series of several treatments there, to kind of help minimize those symptoms and to get those patients feeling back normal. And then after that, we'll be looking at doing some regular scheduled follow-ups, typically kind of a month after, to see what do the glands, or what does the eyes look like prior to our treatments, and then what do they look like after our treatments. And we've got some great equipment here that allows us to really actually show some photographs from before and after, and give us some quantitative measurements of how long does that tear film stay on the eye, and we can follow that to see how successful our treatments are. But we'll usually do a month follow-up, and then depending on where we're at from there, we'll make a plan for the following year of how many when we'll see patients back, or what we're going to kind of do to help our patients on that. I don't know if that's similar to what you do.
I agree. Yeah, especially when a patient who we've gone through the whole treatment process, and we really want to reevaluate you about a month out just to see what your eyes are capable of doing, if they're able to maintain that level of improvement that we have seen you gain along the way. And if you have reached that point, then we may see you back on a quarterly basis if you're the state of your dry eye is very fragile, or we may see you back twice a year at that point, or just at your next annual visit. So it really just depends on the level of improvement you've obtained and the level of severity that you're at, and how closely we think we need to watch you. So.
Perfect. Yeah. So with all of that being said, let's go ahead and let's talk about treatment. So we talked about evaluation last time you were in. So we always evaluate the patient so that we can get an idea of what steps we need to take moving forward for your treatment plan, because everybody's going to be different. One person, I could need X, Y, and Z, and Dr. Franklin needs A, B, and C, and Dr. Schwertz only needs A, so everybody's going to be different. That's why we do the evaluations, so that we can see where your source of dry eye is coming from and set up the correct treatment plan for you. So once we've done that, one of the treatments we offer is called Intense Pulse Light, which we also call IPL for short. And so I'll let Dr. Franklin and Dr. Schwertz tell you more about what exactly IPL is, what it's targeting, and then what to expect and downtime and all that jazz. So let's touch base on IPL.
Yeah. If you want to go ahead.
Yeah, so I'll start. So, Intense Pulse Light is something very similar that you may have seen or even experienced through your dermatologist in doing some skin type treatments. Its initial design is to lighten redness of the skin, maybe tighten up some fine lines and wrinkles, lighten up some sunspots, and it does a really good job of those things. But we found through a ton of ongoing research that when we use that same machine, or machines that are kind of adapted to use on the eyes, and we treat over the eyelids, that we can actually put energy into the glands that secretes the oil layer of the tear film, and we can help make those glands function better. Sometimes going from very little function of the glands to a lot of function, but everybody's a little bit different there. And so these treatments are really geared towards our meibomian gland deficiency patients, which I think you guys talked about on the last question and answer. But they do a really good job of kind of upregulating the amount of oil that we get out on the eyes, holding the tear film on the eye for a longer period of time, and also lubricating the eyelids as they're opening and closing across the eye itself. We typically do a series of those treatments, anywhere from 4 to kind of 6, patient depending on what's needed, to really get those eyelids and get those glands flowing and the oil back flowing to make you feel more comfortable. Going on. I'll let you add to that.
I completely agree with what you stated, and a lot of patients who also have comorbidities, like rosacea is a big one, and a lot of patients also have a subtype of rosacea that's ocular rosacea. So if you have a lot of those unhealthy blood vessels that are feeding inflammation to the meibomian glands, the IPL technology is designed to help reduce the source of the inflammation brought to the adjacent structures to your eye with those blood vessels, and helps to reduce the level of redness and inflammation that you have there. So not only are we treating the eyes areas and helping with the glands, lubricating the oils into your tear film, but we're also addressing the skin area. If you have inflamed areas on your cheek, or on other places on your face, it's important for us to address those sources of of inflammation, so that way they don't continually affect your eyes as well. So
yeah, and so we do tend to get some of the same results that you would get with if you're having these treatments through dermatology. We're going to lighten up some of that redness, and that's actually going to help us to be able to help the dry eyes as well. So it's kind of a neat thing that all these things work together, and we're able to holistically kind of treat the body there.
And like you said, so we do a minimum of 4 to 5 treatments. It's a package. And the reason we do that is because it takes that many to get those results. I mean, typically after the first treatment, you're not going to feel any results. There are some people who do. I know I did. Those results may last a day or two and then go back to what you were feeling prior to coming to us, and that's normal. Sometimes after the second treatment, it's the same as the first, but you may feel those results a little bit longer. I know for me personally, between the third and fourth treatment is when I felt the longevity of the results lasting and I was comfortable. But certainly after the fourth treatment and then the fifth, was good to go. But we do those because it's important to note that you're not going to see the results immediately. So we don't want you to leave here feeling like, well, great, I'm doing this. It's not going to work. No, it's going to work. You got to give it time. We've got to really get in there and penetrate those glands and make sure that we're getting them working again, and that's not going to happen after the first time. So typically, like I said, between the third and fourth, sometimes after the second, people tell us that they're seeing those results lasting longer. But there is no downtime to it. We can treat you here in office. You can turn around and go do whatever it is you were going to do the rest of the day, and you don't have to have a driver here with you. It's not anything that's so invasive that we have to tell you can't drive or you're not going to be able to see or anything like that.
That's a good point.
Yeah, it's an in and out. You leave here looking just like you did, maybe a little bit better because your skin's all glowy than when you came in. So the second treatment we offer is called radio frequency. And again, it kind of, the wand actually kind of looks a little like this, but it's bigger. But I'll let them touch base on that. We call it RF for short. So y'all take over on the radio frequency.
Yeah, go ahead.
Okay. Radio frequency is a heat treatment that we do in office that provides thermal energy to the adjacent structures to your eyes. So similar to IPL, radio frequency is found oftentimes in dermatology and those type of settings where you're looking for more cosmetic changes to the skin. But in our setting, we're really using it more as a therapeutic treatment to help warm up and melt down a lot of the waxy buildup found in your meibomian glands. So this treatment consists of doing about 7 to 8 minutes of a heat type of massage on each eye, both upper and lower. And a technician or the doctor usually is helping with that process the whole time. Once we finish that treatment, we usually want to take a step further and help move that blockage out by doing an expression in office. So.
Yeah, and so with the radio frequency, one of the things that are probably the process behind which why dermatology uses it is it activates the fibroblasts to produce more collagen, and collagen is going to help tighten skin and tighten those structures, and that helps us too again in our dry eye. If we're tightening up the eyelids themselves, we're allowing that structure to perform more like it was designed to. And so all these things just really do help into protecting our eyes and to making us feel better as we go on.
Yeah.
I don't know about you, but I have a lot of my patients say, hey, this felt like a spa treatment for the eye. So this is a very comfortable treatment. Patients tend to really like it.
They do. It's very comfortable. The temperature is adjustable, so we want a therapeutic temperature of around 38 degrees to 40 degrees Celsius, which is around 100 to 102 degrees Fahrenheit, roughly. And so for most patients, it's a very comfortable temperature, but it is customizable. It is adjustable depending on how sensitive you are to the heat. And so just like Dr. Franklin said, a lot of patients really love it because it feels like they're coming in to get a spa on their eyes, but it really is truly part of their dry journey. So.
Even had a couple of patients fall asleep during it. So
It's
not be too bad.
Yeah. It is very relaxing for sure. Okay, so to follow that, there's a lot of times that we do these evals, and after evaluating it, y'all will set up the patients with a package of IPL and RF where we alternate the two. So can we touch base on, why we do the two, or what's the purpose in alternating between the two?
That's a good question.
It is a good question. I think for me, doing the multiple treatments or doing the different modalities is that each machine is going to be working on a little bit different part of our eye structure and what's going wrong with our tear film. And so I think by the combination of these two is really kind of gives us a better outcome for our patients on that end. And that's what I see, now not every patient's going to need both treatments, and it really just depends on during that eval. And that's why the eval is so important, that we know exactly what's kind of going wrong with that tear film so that we can tailor these treatments to each patient, because every patient's a little bit different.
I agree. And so when we're looking at a patient and looking at the information presented to us, every patient needs something a little bit different, but in the case that they might need both treatments, with the IPL technology, what you're addressing is a lot of what we talked about, melting down the blockage, helping to reduce the inflammation, and it really helps to transform the meibomian glands on a cellular level, helping the function of those glands actually work better. So oftentimes if patients come and see us, the function of those glands they're really not working well at all. So you actually have to address that function, and but to encourage that, you've got to clear that blockage out with the heat. And so that's what I tell patients oftentimes, is that you've got to clear that blockage out, allow that gland to do what it's supposed to do, and to encourage increased function with the IPL treatments. And that's why this alternating effect may work well for you. So
Yeah, totally agree.
Yeah.
And same with IPL, there is no downtime to RF. You come in, we do the treatment, don't need a driver to take you home, can go out and do whatever it was you were planning to do the rest of that day, so no downtime. It's the same with IPL. The next option that we offer is something that we have a lot of patients call about LipiFlow. We do have LipiFlow here. I will say I think we found that we were having much better results out of our IPL, so we've used our LipiFlow on several patients before, just because that's what they're familiar with, that's what they want to use, and that's fine, and it's great. But we do have TearCare here. It's not our go-to, just because we have had much better.
You said TearCare,
LipiFlow. Sorry.
So LipiFlow is a
I'll get with
good
it in a minute.
treatment. It was one of the first kind of thermal treatments that came out for dry eye, and it really filled a need that was around when that machine came out,
Right.
and it was doing really good for us, and it still does
Absolutely.
some good things,
Yeah.
and it's still, depending on the patient and what's kind of going on with the patient, it may be a good choice.
Mm-hmm.
But now thankfully we have so many different options
Right.
that we're able to tailor even more so to the patient of
Absolutely.
what they're needing
Yeah.
on that.
Yeah, within the dry eye treatment spectrum, like we touched on last week, the majority of our dry patients are meibomian gland deficient patients, or MGD. So a lot of the treatments that are available are to address those needs, and LipiFlow being one of the initial pioneers in the industry. And then now we have options like radiofrequency, which provides thermal energy, and then TearCare, which also provides thermal heat. So we have a lot of great options to provide the type of heat that your oil glands are needing to really restore a lot of the damage that's been done. LipiFlow, I agree. I've had patients who have done really well with LipiFlow. And with every type of treatment you see in medicine, there are pros and cons to every treatment.
Right.
And so with LipiFlow, it's a thermal pulsation type of treatment, and it's an activator that you apply to your eyelids, and it's a 12-minute treatment, and it actually it applies temperature at a certain level and pulsation simultaneously. So the idea is that you get the glands expressing and the heat all at the same time. And so some patients really like that. They've had good improvement with it. But TearCare, on the other hand, is a treatment where you get external heat applied to the outer eyelids, and that treatment's applied for 15 minutes, but there's no pulsation with it. So that's where the expression done in office is necessary. And then, of course, we talked about the radiofrequency. So they all have their places with our patients. So,
Definitely. They're all slightly different, but they all work, really well for the right patient.
Right.
I think TearCare being a little bit newer,
Right.
than LipiFlow, they're just different,
Right.
but they have their place,
Yeah.
and that's the great thing, that we have so many different choices. Because you guys out there may have experienced certain treatments, and
Right.
you may or may not have gotten some success with resolving your symptoms, but if you didn't get a lot of success with one, don't give up. I mean, there are other treatments out there, and these treatments really do work well for our patients. And technology is just ever changing. I think with any aspect of medicine, technology is always changing. I think one of the biggest things that you guys touched on last time is that eval, and that's where the eval is so important, is that we make sure that we're trying to pair our treatments appropriately with our patients.
Absolutely.
Right, and that's a good step into this. So you just spoke on TearCare, which is what you just said. So following that, like you said, it may work for some people but not others, and that's where y'all get into what mild, moderate, and severe dry eye, right? So you're looking at all the testing that's being done.
Right.
So when you're looking at that testing, what other factors are you looking into? You know, if the patient's on a lot of medications or they're doing a lot of drops, like what factors are you looking at to determine, you know, is tear care right for this person? Is LipiFlow right? Or do we need to go more aggressive and get in there with our IPL and our RF? So what factors are you looking for to determine what stage these patients are in and determine their treatment plan?
Yeah. I think the biggest thing with deciding what treatment is really looking at the function of the glands. When we look at the evaluation, we have all the data given to us on the tear breakup, on how quickly your tears evaporate, the structure of your glands, how much tears you're producing, and then lastly the function. So the function of those glands is really telling as to whether one treatment is going to be better for you versus the next. So, and also the structure that you have existing within your eyes. If you have majority of your glands present, which you know can be seen through those infrared imaging that we do, but they're extremely obstructed and they're not working well at all, you're going to need a lot of heat and a lot of energy in order to release that blockage. If you have really good structure and the glands are somewhat obstructed but they're not fully obstructed, there's some movement that we can get from that oil, then you may not need as aggressive technology. You may need something like a tear care or LipiFlow to remove that blockage. And so I think that's kind of where I base my decisions is, you know, all the information and the function of those glands. But, you know, you may have something a little bit different.
No, I completely agree.
Yeah.
I think one of the things that we probably both do is also listening to our patients, you know, understanding what our patients are going through on a day-to-day basis. And I think that's a huge part of what we do is to hear them and to, you know, understand why they're here and understand what they have already gone through. You know, a lot of our patients that are coming to us have already done artificial teardrops. They've moved into maybe some medicated drops. They've, you know, done several things, but it has not given them the relief that they're looking for. And so, you know, by listening to our patients and really kind of diving into, you know, what are their goals, and then trying to tailor these treatment plans to, you know, work on that.
Right.
You know, we've talked a lot about the treatments of what do we do for the meibomian glands and getting those back to normal, getting the tear film back to normal, but there's still this big world of, hey, your tear film's been off for a long time, and now we've got some ocular surface disease to go along with that. And I know I may be getting ahead of you there, sorry.
You're fine.
But, you know, then we have to talk about what do we do for the ocular surface portion of it. So it's not just kind of a one and done thing. It's not, hey, go have this treatment and you're going to be, you know, perfect. It is, we need to look at the whole big picture.
Right.
And we need to get the tear film back to as normal as we can, and then kind of treat any of the stuff that's happened from that. And I think you're probably in the same boat.
Absolutely, yeah. And
But
I know,
again, like you said, understanding that it may not be perfect, but at the same time, it's still needed, and then we need to do that in order to move to the next step to continue to fix what we're trying to fix, right? So,
Absolutely.
yeah.
a lot of the treatments that fall underneath the moderate to severe category are not only the treatments we do in office for the tear film, but exactly what Dr. Franklin was saying, to heal the ocular surface or restore the ocular surface. We touched on this last week with risk of developing corneal ulcers and having risk for eye infections. We see a lot of patients with a severe level of inflammation on their corneas, which is why they have such impaired vision. And so not only are we addressing the tear film, but we're also doing a lot of other things to heal that cornea back up. So it's a very you know, multifactorial process.
It's a process.
Yeah.
It's a big process. And you know, a lot of people who have or who don't have dry eye, or you know, families and friends of our patients who do have severe dry eye or moderate dry eye, you know, their friends and family who don't understand this, you know, when these patients are saying, hey, you know, my eyes are hurting or they're dry and I can't go do these certain things, you know, they don't understand that there's a different world out there than just go to the drugstore and get artificial tears. Right. Dry eye can be severely debilitating if left alone. And so I think that goes back to your initial, you know, this is why we don't leave it alone.
Right.
We don't want patients to get to that debilitated portion and not drive and not work and, you know, do the family outings and all the things that they want to do.
And we've had so many patients that have come in saying that, and that's the joy that we find in doing this, is that we have those patients then leaving and they come back for a follow-up and they're like, you don't understand how much this has saved me, how much I have been able to do, or I mean, and they know they're in pain, but they didn't realize how much it was until we did the treatments, and they're getting that that relief, and it's just, that's such a satisfying part of this job, because we have so many patients who come in and feel the exact way you just described.
I mean, and
I don't
that's,
even want to get in the car and drive. I don't want the air
Right.
conditioning on, but
Yeah.
I'm burning up.
Yeah.
Like,
Yeah.
so,
and that's why we do what we do. I mean, that's why I'm here.
Absolutely, yeah.
You know, just those satisfying moments of these patients coming back in, and just
Yeah.
almost complete different personalities.
Oh my
even,
gosh.
because
Yeah.
they just feel better, and
Yes.
they're doing more things, and so that's just an amazing.
kind of like they're
amazing thing.
hangry. I got to figure out a good way to put like dry eyes. Like, are you hangry? Because that's what's going on.
That's good.
Got to figure something out for that.
Yeah.
But okay, so not necessarily a treatment, but we also do amniotic membranes. So can we touch base on what is an amniotic membrane, and why are we using those to help with dry eye situations?
So I do think it's a treatment.
Okay,
But it's
sure.
not a treatment
In the
for
sense
the
of like,
tear film.
yeah, sure.
It's a treatment for the ocular surface disease part, or the ocular surface problem that the lack of tear film has caused.
Right.
And so I'll let you kind of take over a little bit too. I didn't mean to.
Well, no, that's
jump
fine.
in.
No, that's fine. You can continue. Yeah, continue.
So, the amniotic membranes that we use here, what it is this small piece of amniotic tissue that they take from live healthy births. It is, washed of all DNA and bloodborne products. So there's no donor DNA or blood or anything like that left over. It's really, in this little small disc of tissue, it's everything left over for good, healthy cell growth. And so we place that small disc on the cornea, the clear part of the eye, and we put a clear, what we call bandaged contact lens over it. So when this is on, you as the patient can see just fine. You might have a little blurry vision for a few hours, but then that goes away. But we leave that on for several days to allow it to absorb into the cornea, and it helps to regrow that cornea back in nice and smooth, and kind of helping us to take care of the damage that we have gotten from the lack of tear film. We usually do this maybe a little bit later, kind of as we got into our treatments for our tear film. We'll kind of add this in towards the end of that, although our thinking may be shifting a little bit with some current research.
Right.
But right now that's kind of where we're at, kind of adding this in towards the end of that,
Right.
just to kind of help clear that corneal surface, and to help with some of those symptoms that are left over from the dryness.
I agree. Yeah, you can do it. We do tend to place it towards the end, or some of our patients who come into our clinic for the first time may have some nerve damage, what we call neurotrophic keratitis, and they may need a little bit more expedited movement with the healing of their ocular surface. So sometimes we might pull the trigger on that a little bit sooner to restore the surface, restore the vision, and then work on some of the adjacent structures and some of the other players involved to kind of help keep the tear film healthy and prevent that from happening again. So, yeah.
It's a great treatment to add into all that we're doing. It really, for my patients, it really seems to pull everything together, and kind of the culmination of, hey, I feel fairly normal. When my patients come in and they tell me they're not thinking about their eyes, that is a perfect spot.
It's incredible. That little tiny piece of dehydrated tissue is such an incredible thing to be able to do for patients. Yeah, it is.
So last treatment we offer, we're going to touch base on next week in depth. So we won't go into detail about it, but we also use scleral lenses. They are hard gas permeable lenses that we put on the eye to help hold or retain moisture onto the eye, the surface of your eye. But again, we'll go into detail on those next week, so we won't really dive into that right now. But a lot of the questions we get when it comes to dry eye treatments are they covered by insurance? So amniotic membranes and scleral lenses, depending on your insurance, could be covered by that. When you come in if we need to do an amniotic membrane, we do call your insurance to talk about prior authorizations and to see what your responsible portion of that would be prior to us doing the treatment, so that you're aware of the cost of that. And in a lot of cases, it's just a simple copay, and then your insurance takes care of the rest. And in some cases you may have a deductible plan, and that has to be paid into. So we do get that all taken care of prior to doing that, so you're aware of what the cost is going to be for you. As far as scleral lenses go, depending on if you have vision insurance, such as VSP, and there's the proper medical diagnosis codes and everything matches up right, that can be filed to your insurance for them to cover a portion of it. But again, it's a matter of looking into that and finding out if the right codes are there, the right diagnoses are there, and what your benefits are through your insurance. So those two treatments can go to insurance and could possibly be covered, but we would just have to look into that for you. IPL and radio frequency are not covered by insurance. Those are private pay plans, as well as tier care, correct? Yeah. So those are not covered by insurance.
They're not, and I think part of that is because they are, I'm going to use the term newer treatments, although they've been around for a really long time. Sure. We've been using these treatments off-label, I don't know, for many, many years. And so recently, the IPL, the RF have now been included with the FDA approval label on that. But insurance companies haven't picked them up. And I think that some of that's due to you're still getting some cosmetic benefit off of that.
Right.
And so they're just, still looking at that. Although there's tons of research out there that shows that these treatments are really doing some good. Which is, I think both of you and I are big as far as following the research and, doing things that make sense, of course, to, for our patients. But those right now are not covered. We tend to work with our patients, with some package pricing because we are usually doing multiple treatments. And so we want to make sure that, we're kind of taking care of it all so that you can come back on the regularly scheduled, times, because sometimes timing is, a big part of these treatments. We don't want to go too long in between, the treatment. So we want to make sure that, everything's kind of handled up front so that it's comfortable coming back in on those scheduled times so that we get the most benefit out of it.
And I think that's something we totally skipped over because we get so in depth about what the benefits are of IPL, how we do it, all that jazz. Yeah. We did forget to touch base on the fact that when we start your IPL and RF package, or just IPL or RF, we want you to follow back up every 2 to 3 weeks, or come back every 2 to 3 weeks for your next appointment, because like you said, timing is important. So if we wait too long, then we're kind of letting the benefits of that first treatment go away and we're starting back over from scratch. So we want to make sure that you're following up. So once we start, every 2 to 3 weeks, you will come back into the office for your next treatment until we have completed the package of 5. So I think that's important to note because some people may not be able to commit at the moment because they won't be able to come in for those time or during that time frame. So that was important, and I'm glad you said that.
Yeah, we're really anywhere from 2 to 4 weeks. We try not to go past 4 weeks, but there is some flexibility there for some of our patients who have vacations and stuff like that planned. So.
Yeah. And Dr. Franklin had said, earlier, we may change up how, or maybe Dr. Schwertz said it, I can't remember. We may change up how we're doing that based off some research that we read, or we may change this, and we're constantly looking for research. These doctors are so passionate about dry eye. They truly are on top of like the newest, latest, greatest, best technology and continually looking into the new research that's come out about why this is working and why this isn't working and what's causing this and what's causing that. So, you're coming to the right place if you're coming here for dry eye treatments, evals, whatnot, because they know it all. And if there's something that they don't know, I'd be very surprised. You are very passionate, and your patients speak volumes of you, and I think that's enough to prove that, you are great.
I don't know if we know it all.
They know it all.
We're learning every day.
Well, they know it all about dry eye.
And that brings up a really good point. Dry eye as a whole has not really been well known. And it's more recently that we've got some, great thought leaders in our industry who are putting forth a ton of research, and that is really what's helped us to be able to steer into this direction of having a specialty kind of clinic out here, whereas we have the time to dive into what's going on with our individual patients, to be able to figure out, hey, will this medication work, or will this treatment work, or so instead of just here, try these drops. We're able to really take the research and the stuff that's ongoing, and apply it to our patients to kind of help them get better outcomes.
Absolutely.
And I think some of the biggest feedback and reviews that we see or we get from patients is how much time, care, knowledge, and detail y'all put into every single patient that comes in here to truly help them understand their certain diagnosis, their problem, what's going to benefit them and how it's going to benefit them, and they feel that compassion and that true care and genuine care from y'all, and I think that's huge because a lot of patients go places and they're just another patient in and out of the door, so it's great to feel like when you come here, from the moment you walk in the door, you feel like you're walking into somewhere that's familiar, and that these are friends or family, and it's your first time here, right? But everybody here has such a care and passion for our patients, and we want y'all to leave genuinely happy, and whatever aspect you came in, if it's just for a routine eye exam or for a dry eye eval or just to get glasses, we want you to feel like you're leaving here satisfied, happy, and comfortable with what you got, but also, not just what you got, but just the care and the service that you received while you were here. So
great. And I think one of the things that we really didn't touch on is there are some pharmaceutical medications out there that will help in a lot of instances of things. And so again, goes back to we've got to look at the whole picture, and we'll touch a little bit more next time on the scleral lenses and the fact that those help a lot with our aqueous deficient.
Yes.
So a little bit different type of dry eye.
Yes.
These lenses will really kind of help there, but there's also some pharmaceuticals that help with the aqueous deficient dry eye.
I think that's important to highlight, because a lot of patients not only have the MGD aspect, but they're not producing a lot of their tears, and depending on the type of presentation you have and the type of comorbidities you have, you may be a candidate for some of the pharmaceuticals, which can range from anywhere from topical eye drops to nasal sprays. I think another thing that we need to touch on, just because I think it's important to address everything, is also lid hygiene, especially with our female patients, but not just female patients. A lot of our male patients really have to you have to address that, because the area around the lid margin where your lashes are can harbor a lot of bacteria, and that can cause a lot of blockage and issues with your oil glands. And so we have some great recommendations that we offer for our patients. We even do in-office lid cleansing treatments to help, just get your lids back to a place where they're much cleaner again. And so that's something that we also tailor for each patient as well.
Absolutely.
So,
there's such a long list of things that we can do and that we have available to us to be able to help, that we really can't cover it all.
Yeah.
But, it's great though to know that there are so many different aspects of it and so many different things that we can do just to help.
Yeah. Absolutely.
There's help available.
There is, and so many patients come here and say, I did not realize that there was help available. So that is what we are here for, and that's what we do. We want you to reach out to us so that we can help you, if we haven't already. I think that's it. This one lasted longer than the last one. We almost went the whole hour. Good job, guys. No, hopefully that was a lot of good information for you. Like I had said, next week it'll be myself and Dr. Franklin talking about scleral lenses, which we are both very passionate about because we both wear them.
We do.
They're fantastic lenses. So we'll touch base. If you have any questions about that you would like to see answered, just send us over a message or comment on one of our threads, and we will get that answered for you. That's it. Y'all got anything?
I think I'm great.
I think
Perfect.
we're good.
All right. See you next week.
Thank you.